Hi, this is Courtney with CGT Coaching, and I'm here today with a very special guest, Sadie Minkoff. She's a licensed acupuncturist with a master's in Oriental Medicine. She's an American Board of Oriental Reproductive Medicine Fellow, as well as numerous other credentials and memberships within the fertility and Oriental medicine community. So, Sadie, how did you discover acupuncture? How did you end up in the acupuncture field?
It was actually quite a surprise to myself because I had quite a needle phobia when I was growing up around
Uh-huh.
this person. But I was learning about Eastern philosophy and Eastern medicine, and I was just fascinated, and it really resonated with me as truth in my own experience as well as what I witnessed in the world. And I did end up eventually going to get acupuncture
Okay.
for an injury that I had. And I was so surprised at how I felt afterwards and how the process and the experience was actually very calming and relaxing. So not at all what I expected from acupuncture with needles, because it does involve that. So
Great.
it changed my entire view, and then I eventually actually decided to pursue it as a career.
That's amazing. Yeah, I know my first experience with acupuncture, I wasn't sure what to expect. And yeah, I think once you actually try it out for yourself, then you can really see the benefits that it has for you. I owe a huge chunk of gratitude to acupuncture for my ability to conceive my son. So um, I feel like it's a huge benefit for anyone who's trying to conceive or just looking for ways to better their health and restore function in their bodies. So tell me about so you start out in acupuncture, and what led you to actually focusing in on fertility?
Yeah. So yes, I was a generalist for quite a while, and to be really honest, I love learning and I love treating all kinds of different things, but I have set very high expectations for myself, and I felt like I needed to be an expert in everything. So I personally knew that I wanted to have, a child eventually, and I came from a family history of medical professionals, and my mother was an OBGYN nurse practitioner. So that I'd always been around, OBGYN and all of that. I'm the oldest of six children. So there was a lot of reproduction going on.
Gotcha.
and and that was really my fascination. I was just so inspired to see and witness the impact that we could have on reproduction. So on some level, since I was a young kid, this was my path. But on another, once I started practicing, it just became my love.
Mm,
I learned everything there was to know. And this is some time ago, so things have changed enormously in at least the Western medical approach to reproduction, and the whole IVF process, in vitro
right.
fertilization process, has actually changed quite a bit since then. And there weren't a lot of resources, you know, back in the day.
Yeah.
so, um, and then it organically grew and grew to the point
Mhm.
where, people were seeking me out, and that my practice was growing exponentially in that specific field. And I decided, you know what, this is actually all I want to treat is preconception and pregnancy and postpartum care. And then any hormonally related issues, thyroid issues, menopause, all of the related endometriosis, PCOS, things like that.
Gotcha. Yeah. So what can you do through acupuncture to actually help facilitate fertility or women's health?
Absolutely. So, from a biomedical perspective, we
Mhm.
know that acupuncture modulates the immune system, which
Mhm.
more and more Western medicine is seeing as a huge component to infertility
Mm-hmm.
and current pregnancy loss and things like that.
Yeah.
We can help the nervous system, which there's also the endocrine system, right? And so we're talking about communication between the brain that produces hormones and then through the blood circulation gets those hormones to their target sites. And so we can have a huge impact on circulation, which is just allowing that process to happen. And unfortunately, as we age, our circulation diminishes. So we can sort of make up what we're losing as in time. And then the other component of the nervous system is stress and its connection to hormonal balance. So if we can support that process in a consistent way, we will see hormone balance regulation, better, stronger cycles, stronger uterine lining, better egg quality. And so that's from what we know acupuncture does. And then on a more holistic level, what we're doing is supporting resources for your body that we can then, of course, direct to your uterus and ovaries with the acupuncture. And those resources come on a physical level, but also an emotional level, because this is one of the most taxing things. I think you would agree that
Yes.
anyone can go through. And so it was really my intention and my mission to create a space where people could come and get their questions answered and, you know, support their fertility, but also support themselves emotionally and mentally, because it's quite a roller coaster that people go through. And we really set aside enough time where people can get all of their questions answered, or sometimes they just need to cry, you know, and be there in a space where it's safe.
Yes. Yeah. Just having somebody that you can go to that you know that's going to understand you and support you can be a huge weight off your shoulders, because when you go into your doctor, sometimes it's just a lot of medical information and, you know, checklists of things that tests that need to be run or things that need to prescriptions or whatever. And you don't really have that emotional support, and it's like a lifeline there.
Exactly. That's well said. Yes. Mm-hmm. Yeah.
So tell me a little bit more about how acupuncture works. So someone who hasn't experienced acupuncture before, what's involved? I know there's needles, right? But
Yes.
what is that? Yeah.
What someone can expect from their first visit is that we set aside quite a bit of time to have someone come in, sit down with us. We go through their entire medical history, as well as just how they're doing overall in their health. Again, this is holistic medicine. So we're assessing and evaluating how someone's sleep is, how their digestion is, how their stress is, again, as well as their reproduction. How are their menstrual cycles? Is everything, you know, on target? And answer any questions that they might have, explain what we do, and create a plan, a treatment plan together. And then we give them a treatment that day as well, so they have a real experience of what that's like. And then they leave with, you know, a good ground under their feet to be able to have a plan.
Okay.
So acupuncture is a physical intervention. So it's easy to think of it as something like exercise, where, you know, if you do it once in a while, you're going to have health benefits, you know, that we sort of like what we just went over. You're going to oxygenate your blood, you're going to have a release of endorphins and feel better, and there will be benefits. In fact, there have been studies that show as little as 2 treatments can actually improve IVF results.
Wow.
It's amazing.
Yeah.
But the scope of what we can accomplish is limited in, you know, by just a few treatments. And
Right.
cumulative, you can go back to the exercise analogy. If you exercise, you know, once, twice a week, you're really going to move your health forward. And so that's our goal, is to support definitely like an IVF transfer or something like that. If that's where somebody is, we meet them there. But in an ideal situation, we would follow them for a couple of months, or at least sort of the maturation process of the egg cycle, so that we can give them the full impact of as that egg matures and gets ready to ovulate, that we have given it all of the hormonal communication, all of the nourishment, take away all the waste possible, and give it the best chance for being a viable, successful pregnancy.
That's awesome. Especially having something that you can support you with IVF, because a lot of times people don't think about using Eastern medicine in conjunction with Western medicine, and that they can work together to support your body, and how each thing affects another part of your body. So, your liver function and your kidney function and all contributes to how your hormones are functioning.
Exactly. Everything is connected,
Yes. Yeah. And I feel like a lot of, with the Western medicine approach, is more symptom based. So they dial in specifically to a specific area, which is awesome. But there's the other piece too, right?
That's right. And yes, so that integrated approach, I'm a huge advocate for. We very often will utilize Western medical diagnostics, or even tell people at a certain point, we highly recommend that you go and talk to your OB or your RE and ask these questions, because they're experts in that area, and it would be very beneficial to know. They look at the microcosm, meaning labs, fantastic. But we go beyond that to look at the macrocosm, which is, how is everything coming together in your life? How is your overall health? And how does that impact your fertility?
That's wonderful. Wonderful. So with someone that is starting out with acupuncture, do you have a certain time frame for them as far as for number of times per week? What do you recommend?
So we do have some general guidelines that in our field we can go by. So if someone just calls me and asks that question, which happens every day, I can say, generally speaking, if you're under 35 without significant issues that are known, we're going to recommend that you come in once a week, and that then as things get more complicated and someone does get advanced in age, we're going to increase that to twice a week. And we've seen that we've even seen it in studies where twice a week is to a certain degree, especially in the context of an IVF, because that's when studies are done, they try to control the environment as much as possible. We see that is of great benefit. And again, it's going back to how much can we influence the system? How much can we get there?
Okay.
But the reason why we have them come in and do such a detailed evaluation is because everyone is very unique. And everyone's circumstance is very unique. It may be that they've been trying for 6 years, but they've suddenly found and removed a polyp that was certainly getting in the way. That's just an example.
Right.
It's almost like they're starting fresh. Now, they're not starting fresh emotionally.
Right.
They do a lot,
Yeah.
But from, how many treatments a week, we're going to say, you don't really need to come in at that much unless they're one. Does that make sense?
Sure.
So everyone is a very unique individual, and tailor our treatments based on their unique circumstances, but also where they are in their cycle, what kind of interventions they're using. So
awesome. Yeah. And I know before you mentioned some conditions that contribute to infertility, such as PCOS and endometriosis. What can you do with conditions like that to improve fertility? Because I know a lot of that from a Western medical perspective requires, laparoscopic surgery or, intervention in that way. So what can you do from an acupuncture perspective to assist with that?
So something like a laparoscopy for endometriosis, for example, we're going to work always with your whole team.
Yeah.
And so what we see is that although the masses have been removed surgically, which at a certain point is really incredibly helpful. It can just turn the tables, right? That could be the thing that really helps.
Right.
We also know that endometriosis often comes back.
Mm-hmm.
What we're looking at is what's the underlying environment that allows this disease to arise in the first place. For people that may not know what endometriosis is, it's when endometrial tissue, which should be inside the uterus, starts to grow outside of the uterus in the abdominal cavity, or it could grow anywhere, but often right outside of the uterus. So they can go in and remove the tissue that's there. And sometimes people have no symptoms at all, and they go in and they have like advanced stage endometriosis. Some people have really what one would think would be very clear signs indicating some issue, and they go in and it's very mild. So on one hand, that's a really valuable intervention. On the other hand, we then want to go beyond that and say, okay, well, there are always pro-inflammatory cytokines associated with endometriosis. It's an inflammatory condition, and at this point, they really are seeing a lot of commonalities between it and autoimmune conditions.
Okay.
So, like there is an association with migraines and endometriosis, so yeah. So what we can do is then take that more aggressive intervention and follow up with, okay, how are we going to reduce inflammation and actually change the environment so that not only does it not come back, but, if your goal is to just get relief from the endometriosis, but if your goal is to get pregnant, how do we create the most receptive environment for implantation and growth of a baby, healthy baby?
That's wonderful. Awesome. So what about women who maybe are considered advanced age? I hate using that, but especially in fertility, it's like 35. You're an old woman now. Is there anything that you can do through acupuncture to support that as well?
Yeah. So as we mentioned before, circulation declines.
Yeah.
So when we get older, we're just not getting the resources to our reproductive system as we once did.
Mm-hmm.
Our bodies prioritize what is vital for life. So in wisdom, naturally, we're going to first direct resources to our heart and our lungs and our kidneys and things like that. And then secondarily, interestingly enough, our brain gets attention.
Interesting.
Our uterus and our ovaries get attention. There was actually a study where they showed that there was a correlation between the temperature of one's hands and artery perfusion, which means blood flow to the uterus.
Okay.
Your extremities, one could think of your head and your uterus and your hands and feet as extremities. So one of the questions that we always ask is, do you run cold? Is it cold to the core, or is it just your hands and feet? And so these questions might seem like, who cares? But that's why we ask some of those questions. And I can talk to you about why our other diagnostic methods that you mentioned as well, like looking at your tongue and things like that. But in essence, what we want to do is with the acupuncture, redirect those resources that are going elsewhere to the reproductive organs. And we want to assess the resources that you have. So then through nutrition, supplements, herbs, if it's applicable, lifestyle, we're going to build up resources. And then with the acupuncture, we're going to direct them again to where we want them to go for reproductive health. Yeah. So for advanced maternal age, that's sort of the mechanism of action. We know that there are not as many quality eggs available. So we really want to take what we have and nurture it as best we can all the way through, not just to ovulation, but then, through gestation, so that we can have a healthy pregnancy.
That's wonderful. Yeah. I know usually especially with high stress and just your body trying to function, it's going to put all of its nutrients and energy and life force into those key components, like you said, your heart and your lungs. And through this process, it allows you to kind of direct that energy there as well. So it's not, getting the short end of the stick and just whatever's left over at the end, right?
Exactly. Mm-hmm.
Yeah. So is there anything else that you feel that people should know as far as, someone considering acupuncture as assistance to fertility?
Well, I think that it's never too early to start thinking about reproductive wellness, and it's never too late. We can always have some impact on health and well-being. And I think that when I was personally struggling with fertility issues, um, I really wished that I had had a resource and a sanctuary where I could go. And so I have worked really hard to create that for other people. And I would like people to know that they do have resources available to them, because this can be a very isolating and lonely process. I know that more and more it's become commonplace to talk about this, which I think is fantastic. But really, like 1 in 8 couples is struggling with this. So it's very common, but it doesn't feel like there's community support, where your friends and family are in the know about it. And there's a reason for that, because we don't talk about it.
Right.
There are resources that are there for you if you're going through this.
Wonderful. Thank you so much. Yes, that's something that's hugely important to me. And when we have a place someone that we can go to, or a place that we can go to, a resource who we know is going to be on our side and going to understand what we're going through, it makes a huge difference in your mental sanity, your experience in the process. And ultimately, I feel like it has an impact too on your success.
Yeah, that's right. When we know that people that stick with it, and I see in my practice, the people that stick with it, most of my patients get pregnant, because it is about perseverance. And if we're given, the opportunity to do that, and with support, we have so much more capacity to, bandwidth to keep going. That isn't to say that everyone's has a very unique path.
Right.
And we encourage people to be really clear about when it's time to take a little break, or, try something new. But really, the people that stick with it are successful. So I had somebody yesterday who was on her absolute, she had gone through years of treatment before she came in to see us, and on her very last embryo transfer. And she was successul, to the surprise of everyone involved, our age, And
yeah.
so it's delightful. But she had several times thought, okay, I need to not do this anymore, and now she is having a baby. So it is about support and how we can show up for each other.
Yes.
Mm-hmm.
Well, thank you so much, Sadie. I really appreciate all that you do for women trying to conceive, women's health, and I love the environment and what you've created here, so that women can feel supported in the process and have a resource that they can use to help them on their journey.